Jawbone grafting in dental implant placement. Jawbone grafting is an advanced dental procedure typically indicated when a patient's jawbone lacks sufficient density or volume to safely and effectively support dental implants. The purpose of this technique is to replace resorbed bone in the jaw by using bone graft materials to stimulate new bone regeneration. As the natural bone grows, it gradually integrates and replaces the graft material, forming a fully restored and structurally stable bone area. Jawbone grafting is commonly required in the following cases: patients who have experienced long-term tooth loss leading to severe jawbone resorption, patients with thin or low-density jawbone, insufficient for implant placement, patients who have worn removable dentures or dental bridges, resulting in progressive bone loss over time, cases of tooth loss in the posterior maxilla, upper jaw, near the sinus cavity, which often require a combination of bone grafting and sinus lift procedures. Jawbone grafting procedure at Dr. Care Dental Clinic. Step 1. 3D CT scan for oral health and jawbone assessment. A 3D cone beam CT scan is performed to evaluate overall oral health and the condition of the jawbone, enabling precise treatment planning. Step 2. Oral cleaning, sterilization, and local anesthesia or sedation. Prior to surgery, the surgical site is thoroughly disinfected and local anesthesia or pre-medication is administered to ensure patient comfort. Step 3. Preparation of the recipient site. The surgeon will create a mucoperiosteal flap using 3 precise incisions. Use a periosteal elevator to carefully detach the mucosa and periosteum, fully exposing the recipient bone site. Perform decortication using a surgical drill to create multiple bleeding points, which enhances vascularization and graft integration. Step 4. Bone graft placement and membrane coverage. The bone graft material will be mixed with autologous blood or sterile saline to form a cohesive mixture, which is then carefully packed into the prepared defect area. A resorbable or non-resorbable barrier membrane is placed over the graft to protect and stabilize the site. Step 5. Suturing and postoperative care. The mucoperiosteal flap is repositioned and sutured to cover the grafted site, and the oral cavity is thoroughly cleaned post-surgery. After the procedure, patients may experience mild bleeding, swelling, or low-grade fever, which are common postoperative responses and typically subside during the healing phase. The dental team will provide detailed post-operative care instructions and schedule follow-up appointments to monitor graft healing. Strict adherence to the dentist's guidelines is essential to ensure optimal recovery and minimize potential complications.